PMS symptoms and PMDD symptoms. So perhaps you're wondering whether you have PMS or premenstrual syndrome, or PMDD, which is premenstrual dysphoric disorder, what the symptoms are, and what is the difference between PMS and PMDD. So let's talk about PMS symptoms and PMDD symptoms. Hello, I am so thrilled to be here. For those of you that don't know me, my name is Michelle Cooke. I am a period and hormone naturopath, and I help women struggling with their menstrual cycles have easy, pain-free periods, balanced hormones, and emotional well-being. And I run a clinic based in Melbourne, and I see patients both online and face-to-face. So if you have any questions or comments as we go through this live today, be sure to pop them down in the comments box down below. If you're watching the replay, you can do the same. If you're a little bit shy, you can always send me a PM or a DM, and I'm more than happy to answer those for you. If you're enjoying the content, be sure to hit those likes and loves for me. And without further ado, let's get started. So what is PMS? So PMS, or premenstrual syndrome, is when a woman will experience reoccurring symptoms that will occur in the luteal phase of the menstrual cycle. So that is the phase that is after ovulation, but prior to the next period. And it's generally sort of 1 to 2 weeks before that next period starts that these kind of symptoms will rear their ugly head. So generally, those symptoms are relieved once the period commences, or at least a few days into the period you find you get relief from those symptoms that you were experiencing. And approximately 85% of women have reported having premenstrual symptoms. So that's quite a lot, isn't it? So that's a big proportion of women. Whereas with PMDD, or premenstrual dysphoric disorder, that's more around 6 to 8% of women for that particular scenario. So a severe form of PMS is known as PMDD, so that premenstrual dysphoric disorder. And this is really next level in terms of the symptoms that you would be experiencing, quite different to that of PMS. And it presents with more severe symptoms, and it really does affect day-to-day function. And I'll discuss a bit more about that as we go through. So there's often irritability, depression, and mood swings that are more severe. But as I mentioned, I'll discuss more about that a little bit later, about the specifics of PMDD. So PMS symptoms, what are they? And sometimes the symptoms may differ from cycle to cycle. You might have different ones before one period, and then before the next one it might be a little bit different. So these are some of the symptoms that could be experienced. So emotional or psychological symptoms, we have loss of control, feelings of inability to cope, depression, anxiety, angry outbursts, mood swings, irritability, nervous tension, confusion, lack of concentration, tearfulness, forgetfulness, social withdrawal. Now, what about the physical symptoms? Let's discuss that. So it could be things like sore or tender boobs. They could be lumpy boobs or cystic breasts. There can be headaches, abdominal bloating or discomfort, or sorry about that. You're just resting on a tissue box there, so it is a little bit precarious. Or there could be distension of the abdomen as well. Fluid retention, food cravings, so it could be for sweet foods, fatty foods, for alcohol, increased appetite. There can be libido, which can be altered as well, joint or muscle aches or pains. There can be tiredness, there can be premenstrual acne, pelvic pain or discomfort, insomnia, sinusitis, recurrent colds, so that's happening sort of prior to the period, changes in bowel habits, so you might have sort of differing habits there, palpitations, fainting, dizziness, recurrent vaginal thrush. There can be a genital herpes outbreak before your period as well. I already mentioned that one, the changes in bowel habits. Okay, and there's different types of PMS as well, so there's subtypes of PMS. So let's discuss those. So we've got PMSH, which is hyperhydration. So that's very much the main symptom there is fluid retention. We've got PMSD, which is depression. So the main symptom is obviously for that one, depression. PMSA is anxiety. So that's associated with nervousness and irritability, and you're obviously feeling quite anxious as well. PMSC is for cravings. So you could be having cravings for sugar before your period, or having symptoms of hypoglycemia or low blood sugars. And there's PMSP, which is for pain. So that's sort of the predominant feature that's presenting for you. But it is actually possible to be a combination of those subtypes. You don't necessarily have to fit into one of those. You could have a few of those different things going on. So what is the cause of PMS? So it is still quite poorly misunderstood, and the main cause is not actually identified in this point in time. But there are some potential influences that may be contributing to PMS, so let's talk about those. So contributing factors, so it could be things like stress, carbohydrate intolerance, there could be nutritional deficiencies, particularly B6, magnesium, vitamin A and vitamin E, just to name a few. You could have deficient adrenal hormone secretion, so your adrenal glands sit above your kidney glands and they help you adapt to stress, and they produce cortisol to do that. So there's a deficiency in the adrenal hormone secretion, and that's due to an abnormality in the hypothalamic pituitary adrenal axis. Okay. There could be a serotonin deficiency. There can be sodium and water retention issues due to abnormal aldosterone function. So that's a hormone in our body that regulates water. There can be hormone issues. So there can be several things going on here. There could be estrogen excess, progesterone deficiency, particularly in that luteal phase. There can be prostaglandin excess or deficiency, and that's involved in sort of pain in terms of having pain premenstrually. And they can also be high prolactin or hyperprolactinemia. There can be poor elimination and digestion, so that could be liver function, remembering that the liver plays a very important role in sort of breaking down our hormones and removing them from the body when they've served their purpose, or poor digestive function as well. So we need to remember that we need to be going to the toilet and doing a poo at least once a day, and if you've got any signs of constipation, that means that any sort of estrogen, for example, that's been used up by the body and done, it's done what it needs to do, it doesn't have anywhere to go. So if you're constipated, it's going to sort of stay in the body, be reabsorbed and cause hormonal imbalance, and it can potentially contribute to PMS as well. It could also, contributing factors could be due to prostaglandins, so they're not behaving as they should be. So that's that can sort of add to things like pain. There can be gut bacterial dysbiosis, so an imbalance of the good and bad bacteria in your gut. So I've spoken about this quite a few times. It is very much related to a lot of reproductive health conditions, and we need to really think about this because it can arise in hormone imbalance. So particularly poorly managed estrogen, and as I said, if it's not clearing out the body, it can be reabsorbed and affect the hormonal balance there. So we also need to remember that we've got the estrobolome, which is a specific family of bacteria that actually modulates estrogen, so it's keeping it in check. And so if we've got an imbalance of good and bad bacteria in the gut, this is going to affect the estrobolome and its job of supporting and maintaining healthy estrogen levels, which can also contribute to PMS as well. Also, SIBO is another consideration, and I'm seeing it time and time again with a lot of patients. So that's small intestinal bowel overgrowth. And this can lead to an activation of mast cells, which are a part of your immune system, and it arises in high histamine levels, which can lead to PMS symptoms. And histamine is it's a neurotransmitter. So it can lead to things like, it's a stimulating neurotransmitter. Gosh, I'm doing well tonight, aren't I? It's been a long day. So it can lead to things like headaches, agitation, and anxiety. And also SIBO can arise in intestinal permeability, so things like leaky gut. And that can cause immune dysfunction because things are passing through into the bloodstream that wouldn't normally be there. That causes inflammation. It indicates that there's sort of a bacterial imbalance in the gut as well, and those bad bacteria release bacterial toxins which actually go through into the bloodstream and into the pelvic cavity, which causes a lot of inflammation and trouble there. So that can lead to PMS symptoms as well. Another reason or a contributing factor to PMS is an abnormal neurotransmitter response in response to the ovaries' messaging. So there's a bit of a mix-up there, and that does contribute to PMS as well. So how is PMS diagnosed? So there's no blood test to actually diagnose whether you have PMS. It is literally defined based on the symptoms that you have 1 to 2 weeks prior to your period. So let's discuss that. There is a bit of a criteria. So the diagnostic criteria for PMS, you need at least one emotional or one physical symptom in the lead up before your period. So around that sort of 1 to 2 weeks before, or sort of 5 days before your period at least. And the symptoms stop from days 4 to 13. So generally you would have started your period by then, remembering that day 1 is the first day of your period, and it would have eased by then generally. Symptoms impair functioning, so day-to-day functioning, it's impairing that for you. And the symptoms that you're getting are confirmed in at least 2 cycles or 2 menstrual cycles. And the symptoms are not due to another condition or disorder. So that is the diagnostic criteria. So what is the difference then between PMS and PMDD? So PMDD, or Premenstrual Dysphoric Disorder, is a more severe form of PMS, as I mentioned earlier. So the symptoms cause significant distress or interfere with your day-to-day activities. So things like social gathering, work, school, or with relationships with those around you. You know, it really affects that, particularly with the mood disturbances that occur as well. So the diagnostic criteria of PMDD is, in the majority of menstrual cycles, at least 5 symptoms are present the week before your period. So you need 5 of those symptoms. Remember, for PMS, you only needed 1. Symptoms may improve within a few days after your period starts, so that's similar to PMS. Symptoms become minimal or absent the week after your period. So again, the kind of, the symptoms are sort of tidied up by then. You're usually experiencing it prior to the period. So these are the symptoms of PMDD. So the first thing is 1 or more of the following must be present. So you must have marked tension, anxiety, and or the feeling of being on edge, okay? Number 2, you might have marked feelings of hopelessness, depressed mood, or self-deprecating thoughts, so undervaluing yourself or being hypercritical of yourself, Number 3, there could be marked anger or irritability or increased conflicts with others. Number 4, there could be rapid or exaggerated changes in mood. So there could be increased sensitivity to rejection, feeling suddenly tearful or sad, or there could be extreme mood swings. So you need 1 or more of those. So the next thing you need is 1 or more of the following to reach a total of 5 symptoms. So remember, you've got to have 5 of those symptoms for PMDD. So when you combine this group with the other group, you need that total of 5. So these are some other things you might experience. So sensation of bloating or weight gain, joint or muscle pain, tender or swollen boobs, a sense of being out of control or overwhelmed, significant change in appetite, so food cravings or you're overeating. There can be lack of energy and you're easily fatigued, difficulty concentrating, and a decreased interest in activities. Pardon me. So you can see there's quite a big difference between the two. You need 5 of those symptoms for PMDD, and it's more extreme. It's really, really affecting your day-to-day life and your ability to interact with others, your relationship with others, and yeah, it's a lot more severe than PMS, which is only 1 of those symptoms, and it's not as extreme as PMDD. So can a naturopath help with PMS? Or premenstrual syndrome, and PMDD, so premenstrual dysphoric disorder? So yes, absolutely, and I would suggest seeing a naturopath that specializes particularly in periods and hormones, like myself, to help support you. So perhaps you suspect that you have PMS, or maybe you're thinking maybe it's PMDD, or maybe you've already been told that this is the case for you. So treatment-wise, we would be using natural medicine together, so herbal medicine, nutritional medicine, based on those pathology findings together and your symptoms, etc. Also, we would be discussing diet and lifestyle factors that can influence your PMS as well. And I also use a technique known as Naturopathic Emotional Release, or NER, and that's to look at any underlying emotions or stressors contributing to your PMS as well. Very, very important. I tend to find there's always an underlying emotion or stressor in my experience, and it's important to clear that because we can work on the physical till the cows come home, but if we don't resolve that, it can be difficult for you to move forward and actually heal from that. So in terms of assessment, we know of like all the different factors and contributing sort of things that can add to or contribute towards PMS. So obviously with assessment, I'd be looking at nutritional deficiencies generally through blood tests. I'd be looking at hormonal imbalance as well. So looking at your girly hormones, looking at estrogen, progesterone, testosterone, and all the other goody hormones as well, just to see where they're at through pathology testing. And looking at your thyroid as well, because that plays a big role in periods and things like that as well, and PMS. So we need to be looking at the complete picture, because all these things can contribute to PMS. We'll be looking at your pancreas as well through pathology testing, just to see where that's at, because that can also contribute to, and your adrenal glands too, because remembering stress can be a contributing factor to PMS. So we need to assess if that's a thing for you. And if it's contributing to your PMS. Remembering all the different types, there's 5 different types. You could be one of those types mainly, or you could be a mix of a few different ones. So it kind of depends. Treatment will depend on, you know, what kind of type you are specifically. And then assessing gut health. So this is extremely important. So this might involve sending you off for a microbiome test to look at your gut bacteria in the large bowel, so both good and bad, to see what the levels are and what's going on there. Is anything contributing to inflammation in the body, which can cause hormonal imbalance and can contribute to PMS symptoms. And then we'd also be looking at, if appropriate, SIBO testing, which is small intestinal bowel overgrowth. So that one is a breath test, which is looking at hydrogen and methane gases, and just looking to see if there's a positive reading there. So that's only if appropriate, if your symptoms kind of fit that picture. But I'm seeing it more and more and more. And I definitely do find that if someone's experiencing PMS or PMDD, we do definitely have to look at the gut, even if it's just the large bowel, and maybe you don't have sort of the symptoms to indicate you've got SIBO. We at the very least have to look at the large bowel, because there can be toxins that are produced by the bad bacteria there, called LPS, or lipopolysaccharides, and these can actually translocate to the pelvic area, and it can contribute to a lot of PMS symptoms, including pain as well, and cramping, and heaps of other symptoms. So yeah, it causes major issues. So if you would like support with your premenstrual symptoms or PMDD, or maybe you suspect you have one of these, I would absolutely love to help you. So I would like to invite you to book a free discovery call with me, just to see if we are a good fit, and to see what treatment would involve, and if that's something that you'd be interested in going ahead with. So if you're watching on Instagram, I've got a link in my bio to do that. If you're watching on Facebook or YouTube, I will pop the link down below for you to go ahead and do that. So remember that all my Instagram and Facebook lives are actually on my website blog. So if you've missed any in the past, sometimes it can be difficult to go through all the feed of Instagram, and it's probably just as easy to go to my website, because they're all there with the video at the top and the written description underneath. So if you're a visual learner, sometimes it's nice to actually see it written as well. If you head to reproductivewellness.com.au/blog, you'll find them all there. On Instagram, I actually have a link to that already. So the link is in my bio. So I would like to, actually, before I thank you for watching, does anyone have any questions about the information that we spoke about today? No, that's all good. So I would like to thank you very much for watching today. I appreciate you. And yeah, if you've got any questions, or if you think of anything after this, or you're watching the replay, please pop them in the comments box down below, and I'll answer those for you. If you're watching on my YouTube channel, be sure to like and subscribe so that you don't miss any future videos. And just an FYI, I go live every Wednesday, 6:30 p.m. Australian Eastern Standard Time, talking about periods, hormones, menstrual cycles, and women's health. So I very much look forward to seeing you next Wednesday, and I hope you enjoy the rest of your evening. Thank you so much. Bye.